This is the V60 non-invasive ventilator. It delivers non-invasive BiPAP, CPAP, as well as nasal high flow. It has a high pressure oxygen inlet, so we can deliver between 21 and 100% oxygen. So we'll plug that in first. So for the V60, when we're setting it up in BiPAP and CPAP, we usually start with a dry circuit. For this, we need the pressure line. So we have a filter, an exhalation port. The filter attaches directly into the patient's mask. I'm going to do now. Okay. This pressure line essentially tells the ventilator what kind of pressures the patient's achieving at this end of the circuit. So the filtered circuit goes on this end, and then we attach our pressure line to there. When we're first setting up the ventilator, all we need to be concerned about is the buttons at the bottom of the screen. So the first thing we're going to do is put it in standby. And that allows us to change the settings without the ventilator blowing and alarming at us. Okay, so if we move over to the next button at the bottom of the screen, we're going to press menu. Now within the menu, there are a variety of things you can change, including locking the screen brightness, loudness, ventilation info, but the only thing that we need to be concerned with is mask and port. So we need to go into our mask and port. Now the ventilator asks us to tell it what kind of leak we've got within our mask, and on the front of all of our masks we have a leak number. Leak 1 is are the masks that we want to use at the moment. Leak 2s, 3s and 4s have extra leaks in the circuit which we can't filter, which during the COVID pandemic isn't safe. So we always use leak 1 masks, and if you look at the front of your mask you will see this symbol with a number 1. So we're choosing leak 1. If we wanted to change it, we could move it around. We're going to leave it with leak 1 and press the accept button. The other thing it asks for is what kind of exhalation port we've got. A DEP is a disposable exhalation port, which is exactly what we're using on this circuit. So on the passive circuits with this kind of exhalation port, we need to make sure that says DEP and press accept. Okay. If we move along our buttons again, we're going to go to modes. We have 5 different modes. We have CPAP. It says batch against the mode that you've most recently used, so the batch settings. We have spontaneous timed, which is bi-level non-invasive ventilation. We have pressure controlled ventilation, which is invasive ventilation, which we would never use with a non-invasive mask. We have AVAPs, which is average volume assured pressure support, where you would set a tidal volume and ask the ventilator to use a range of IPAPs to achieve your volume, but we don't use that acutely. So the only settings that we're interested in are the CPAP or the ST. So if you go into CPAP, then it comes up with the things that we need to change or may like to change. So we've got our CPAP, so we touch it, we can change it to whatever we'd like to change it to. So in this instance, 10 centimetres of water, and we'll press accept. We always leave our ramp off. What the ramp does is it ramps up your pressure over time, and we want our patients to be achieving the CPAP that we set immediately because they're acutely unwell. C-flex is a form of expiratory pressure relief, and we find that it really improves patients' comfort and compliance. So if we press it, you can see what it does. So it sets your pressure within your inhalation, and at the start of your exhalation, where you're having to blow out against a very positive pressure, it gives you a little bit of pressure relief, so it drops the amount of pressure within the mask. And that does 2 things. It improves comfort, reduces the work of breathing for the patient, and also stops you getting peaks of pressure within your mask, which can lead to barotrauma. So we usually set our C-flex at 3. You can set it at 1, 2 or 3. At the moment we're setting it at 3. We press accept. Then if we go along, we can change our oxygen. We can change it to whatever we like. We can use the buttons from 21 to 100%, or we can use the circular button at the top and then accept it up there or accept it down here. It doesn't matter. Okay. If we wanted to start CPAP, then we would have to accept our batch change, and then we are in CPAP. So everything we want is set up. There is an alarm screen We tend not to worry too much about high and low minute ventilation and high and low inspiratory pressures in non-invasive ventilation. We do tend to set our high and low respiratory rates, especially in CPAP. We tend to set a low respiratory rate because we don't want our patients breathing very slowly. It usually means that if that happens, they're deteriorating. So we do tend to set our low respiratory rate, but otherwise we set the alarms at the limits of their parameters. We go into CPAP settings. To start CPAP, you can either touch your start CPAP mode, or what we tend to do, especially with a COVID pandemic, is put the mask on the patient, and then as they start to breathe, then CPAP will trigger. So I'm just going to attach that onto a mask. As the patient breathes, and we can see we're now in CPAP mode. At the top of the screen, we've got alarm silence. Next to it, we've got alarm reset, and then we've got these informational messages. So the messages, while they're a problem, flash up. Red is a serious thing that you've got to do something about now. Yellow is for your information. As you've dealt with them, then you'll get a line drawn through them. If you want to get rid of them, you press your informational messages at the top of the screen, and then you get your pressure, flow and volume curves on the front of the ventilator. It gives you lots of information. It gives you, so the turquoise is when the patient's taken a spontaneous breath, and the blue is as they're breathing in, and the blue is as they're breathing out. You've got your respiratory rate, which is spontaneous in CPAP, your tidal volume, minute ventilation, peak inspiratory pressure, patient leak. Now, leak is important in terms of mask fit. We want really good mask fit with our COVID-19 patients, so we're not getting a lot of unfiltered gas escaping into the environment. Between 7 and 25 litres a minute of leak is where we are comfortable and where masks tend to be comfortable, so we make the mask as tight as we can whilst keeping it comfortable for the patient. The ventilator will compensate for up to 60 litres of leak while still achieving the pressures that you've set. If we wanted to change into a different mode of ventilation, if we wanted to change to ST, we could either go into standby again, or we could go straight to our modes. So we'll go straight to our modes this time, and we're going to choose ST or BiPAP. It will continue in CPAP whilst we're changing our parameters. So we've got our IPAP and EPAP. We've got our FiO2, so how much oxygen you want to give. IPAP and EPAP will be determined by the medical staff, depending on the patient's condition. We have a backup rate in bi-level non-invasive ventilation. So if our patient is breathing less than 15 breaths a minute, the machine will give the patient a breath. The I time tells the ventilator, the inspiratory time essentially tells the ventilator how long to breathe for during your backup breaths. During spontaneous breaths, your patient will choose their own inspiratory time. That's only relevant for your backup breaths. Then we have our rise time. Rise time is rise to pressure. So in our patients who are tachypneic, we want to keep our rise to pressure as quick as possible. So we're hitting our pressures before the patient breathes out again. So on the Respironics machines, a rise time of 1 or 2 is a fast rise time where you get to pressure very quickly. A rise time of 6 or 5 is a slow rise time. So in our tachypneic patients, we tend to keep our rise time at 2. We've made a change, so we need to press accept. To change anything, the same as on CPAP mode, you would highlight it, change it to whatever you wanted it to be, and press accept. Once you've done all that, it won't let you do anything else until you activate ST mode. So if you activate your ST mode, we are now in BiPAP. Active mode is ST. Again, we've got the same patient information. While we're in this monitoring state, while we're in this active state of ST, we can change anything at any time just by highlighting it and pressing the accept button. We're tending to turn the ventilator off before we take the masks off patients at the moment, again, because of AGP. So I'm going to do that now. Press the off button, ventilator shut down.